It's 7 a.m. from Fox 35. This is Good Day Orlando.
All right, thanks, John. On the Health Watch right now, from red cheeks to thinning eyebrows. You know, your face can actually tell you a lot about your health. And joining us right now to talk more about that is Dr. Jamin Brabant with the Pure Clinic in partnership with Orlando Health. Great to see you, Doc. Thanks for coming in.
Amy, thank you. The pleasure is all mine. Thank you.
So this is interesting because I think, you know, some of this stuff maybe we ignore, not intentionally, but subconsciously we notice there are changes going on and we're not really clued in. We're not paying attention to what they mean. So we're going to start with our hair. Is that right? Because that can be an important indicator of what might be going on. Why is that?
So, Amy, just to speak in general, like when you think about when you go see a doctor, the most important thing that we do is a physical exam.
Right.
And there's no more visible part of your body than the actual face. So there's little things on the face that we can see that can be triggers or that can tell us that there's something else maybe going on deeper inside the body. So let's start off with the hair.
Okay.
So when you think about the hair, you can think about, okay, is there too much hair growth or is there too little hair growth going on? So if we focus on too much hair growth, especially in women, if you start seeing excessive hair growth on the face, that could be a sign that you have an excess or an abundance of male hormones or androgens. And one disease that's linked to that is polycystic ovary disease. Now let's talk about loss of hair or thinning of hair. So when you look at specific parts of your face like the eyebrows, if you have thinning of hair in the eyebrows, that could be a sign that you have hypothyroidism, so low thyroid hormones, whereas excessive hair growth or excessive hair loss actually on the head of your hair could be hyperthyroid. So the thyroid hormone is actually going high in your body. So these are all things that you can be evaluated either using lab work or physical exam or going to see a physician.
Interesting. Okay, so next we're going to talk about the eyes. Yeah. The eyes have it, right?
Yeah, so interesting thing, if hyperthyroidism, we said could be thinning of the hair.
Right.
You could also see your eyes bulging out as well. So your eyes, as we know, are kind of a gateway to the soul, but for a medical professional, they're actually a gateway to your health. So if you think about your eye, the white area of your eye, and you think about the colored area of your eye, the colored area is actually your iris. So if you start seeing a white circle around your iris, that could be a sign that you have high cholesterol inside your body. Also, if you have little pimples either on your eyelids or around the face, around the skin around your face, that could be also a sign that you have high cholesterol. Now, high cholesterol is very important to diagnose and treat early because it's a significant risk factor for heart disease and cardiovascular disease such as heart attacks and strokes down the road.
Wow, that's fascinating. I had no idea that the eyes would be connected to cholesterol. Okay, so skin is another important one.
Yeah, so skin is very important. So sometimes you can just get little rashes or dermatitis, but there's other things, like if you have a rash, like of certain patterns around the face, like a red rash, that could be a sign that you have some kind of inflammatory disorder inside your body, such as lupus. But one interesting thing about the skin is wrinkles. So we often blame wrinkles on age or stress or anxiety, but there was actually a study done in 2012 that looked at women between the age of 40 and 50, and what they found that women who had worse wrinkles actually had bad bone health. So they were high at risk of osteoporosis, which is weak bones.
Wow.
So sometimes we just want to blame wrinkles on age, but when you go see a physician, you know, that's something we're going to be looking at, especially in women who are at risk for osteoporosis.
Wow, that's fascinating. Okay, your teeth is another one that is an important sign of your health.
Yeah, so the biggest thing is staining of the teeth. So we often see patients that have darkened teeth, and it could be just excessive coffee intake. It could also be smoking. So smoking sometimes can darken your teeth, and you can actually even see it on your lips as well. But one thing that we always look for is erosion or shortening of the teeth, and that could be signs of too much acid in your body. Either the acid is coming from your stomach, if you have reflux, or it could be something such as bulimia, the disorder where you're actually, the vomit from that is causing the erosion as well.
Wow, that's fascinating stuff. Really good information this morning, Doc. Thanks so much, Dr. Jamin Brabant with the Pure Clinic. So make sure to check him out. Is there a website that they can go to?
Amy, the website is purclinic.com.
All right.
And you can also follow us on Twitter. You can follow me on Twitter as well at UrologicMD.
He's very good on Twitter. He's quite the Twitter guy. All right, thanks so much, Dr. Brabant. Appreciate your time this morning.